I'm Anne Rancourt for HIV.gov, reporting live from Boston at the Conference on Retroviruses and Opportunistic Infections. And I'm joined today by Dr. Laura Cheever, who leads the Ryan White HIV/AIDS program at the Health Resources and Services Administration, part of HHS. Dr. Cheever, thanks for joining me.
Thank you so much for having me here.
My pleasure. So, Dr. Cheever, there's so much research being presented here at CROI, and we're about halfway through the conference. What have you found interesting so far?
There have been several very interesting things. I think first is it is the 25th year of this conference, and reflecting on how much it has changed over time. Dr. Harold Jaffe from CDC gave a plenary talk at the beginning of the conference, and he was really able to articulate all the things that have happened in the context of this epidemic, and particularly where we are now, that we have a great opportunity to better utilize things like electronic health records and social media to bring people into care, to understand where we have new disease outbreaks, either HIV specific or even other illnesses, that we can really learn a lot from the path that we took with HIV.
Excellent. And you lead just an incredible program in Ryan White, and I want to make sure that all of our viewers know what Ryan White is. Can you tell us a little bit about the program?
Sure. So the Ryan White program is an incredibly effective program in the federal government. We provide care and treatment services to about 500,000 people, or over half of all the people living with diagnosed HIV in this country. The program is really set up to serve and provide medical services and medication to low-income people that don't have other ways of accessing care. In addition to providing medical care and medications, we also provide essential support services that allow low-income people to get into care and stay in care. And because we have that really full kind of public health approach to being in care, we are actually able to have excellent health outcomes.
That's wonderful. So anyone living with HIV in the United States can receive care through Ryan White?
Right. Because of the Ryan White program, everyone should be able to access care, regardless of your income. If you're uninsured, whatever your situation is, you should be able to get care.
That's wonderful. And so what have you been hearing here at CROI that you might be able to apply in the clinics across the country?
Yeah, so there's been a lot of really interesting things. I think one of the things that we definitely need to do and do differently is some of the research that's come out of CDC and other places where they're using the genetic sequence of the actual virus to see where actual outbreaks are occurring in the country, because they can tie different viruses to specific people to know where transmission is happening. Here at the conference, they've really been talking about looking retrospectively over 10 years of data to see where those clusters are occurring. But if we can make that in real time, we can do great things, because we can quickly intervene. First, by giving people treatment. People that are on treatment with an undetectable viral load it's impossible for them to transmit HIV sexually to someone else. So in the community, they call that undetectable. It means untransmissible. So if you're undetectable, you can't transmit HIV to others. So we can get in and quickly treat people that are in these clusters where HIV is being transmitted. And for people that are in those are contacts of those people and have remained HIV negative despite the risk, then we can make sure those people get onto PrEP, pre-exposure prophylaxis, or medication to help them prevent them from getting HIV. So we need to be doing that in real time, and I think we're right on the cusp of being there.
That's very exciting.
It is.
And so when you attend conferences like this and you see scientific publications coming out, how do you work on a continual basis to translate that research into practice in the clinics?
Yeah, so in HIV, we've done a remarkably good job of doing this. The Ryan White program actually came into being in about 1990, which was before we had highly active antiretrovirals. But we were able to really set up treatment systems, get people into care and help them stay in care, so when the latest advances happen, they can quickly be translated. In the United States, when we had ACTG 076, which was the NIH study that showed that pregnant women taking AZT could really reduce risk of transmission to their children, transmission risk fell incredibly quickly in the United States. Really because the Ryan White program had set up that system where those women were in care and had connections to people that knew about HIV. Similarly, when the first really powerful antiretroviral drugs were released in late 1995 and 1996, we saw a drop in mortality in this country within months. Most diseases, it takes years to get those sorts of translations into treatment. But in the United States, because of Ryan White, we quickly do that. We rely heavily on our AIDS Education and Training Centers program, which is a network of providers across this country that train our clinicians in HIV care and treatment. And we've demonstrated that it's a very effective way of getting those latest changes into care.
Wonderful. And if you're just joining us, I'm Anne Rancourt reporting for HIV.gov from Boston, from CROI 2018, and I'm here with Dr. Laura Cheever, who leads the Ryan White program at HRSA. And so you guys are doing a lot of exciting work in hepatitis C, which is a co-infection that is commonly found with HIV. Tell us a little bit about your work there.
Yes, so in the Ryan White program, about 25% of people that have HIV also are co-infected with hepatitis C. Many of them have gotten that through sharing dirty needles early in the epidemic. Many of those people haven't been using drugs for years, but they remain with this infection. People that are co-infected with HIV and hepatitis C, their hepatitis C actually progresses more rapidly. So it's more important for people with HIV to get treated for hepatitis C. Today we can cure people at an incredibly high rate. Over 90% of people that are treated are cured. And we have people in care on a continuous basis in terms of their HIV. So we should be able to cure everyone in the Ryan White program that has hepatitis C. We should be able to cure them of their hepatitis C. We're working on that. We don't exactly know the best ways of doing that in terms of how to really push out this new advance quickly. We are working with a series of jurisdictions, of cities and states, to pilot what is the most effective way to quickly get people treated for hepatitis C. And we are working on ways to better measure our progress in that. I can tell you, I practice in Baltimore in a clinic where we do have good hepatitis C services, and all of my co-infected patients are cured. So it's very exciting. And for patients, it's very exciting. Just like there's U equals U for HIV, patients that have stopped using drugs years ago but continue with their HIV infection or their hepatitis C infection now are telling me, you know, I could never really leave that drug use behind, and now I can. Like, I know it's no longer with me anymore. Mm-hmm. I'm cured of hepatitis C. I'm not going to be able to transmit it to anyone else. So very exciting news.
That's wonderful to be free of that stigma.
Right.
That's
exactly.
Great. And so there have been a lot of conversations at CROI about the care continuum, which is very central to the work that you do.
Absolutely.
Tell us a little bit about what is the care continuum, why it's important, and what you're hearing here at CROI.
Yeah, so the care continuum is it's a very important way to conceptualize HIV care and treatment. So in the care continuum, you start with all the people that have HIV infection in the United States. You then look at what proportion of them, about 85%, that are actually diagnosed and know they have the disease. Then what portion of them get referred to care and get into care within 30 to 90 days. Of those people that get into care, what proportion stay into care over years, and what proportion of those in care then are virally suppressed. So if you look across the entire United States, among those that have been diagnosed, just looking at those, only about 55% look like they've been virally suppressed. And that's not a great statistic. A lot of those people are completely out of care. We had an important symposium yesterday where Julie Dombrowski from Seattle presented data when they go in Seattle and some other jurisdictions as well and really look at those 45% that look like they're out of care based on their surveillance data. They actually find that about half of those people are actually, there's a reason they didn't have a viral load done or that they seem to be out of care. About half of them are not out of care. Either they've moved out of the area and that's why they didn't show up in the system, or they've died, or there was some other specific reason why they weren't showing up in the system. So the rate is not as low as 55%. It's actually, we're doing better than that. In the context of the Ryan White program, we're very proud. Now, it's a different denominator. These are people that actually have been in care at least once. But among people that have been in care at least once in our program, we have a viral suppression rate that has increased from 69% in 2010 to 85% today. So we are doing incredibly well in the context of when people are getting into care to get them on medications. And that's really because the Ryan White program is just not about a medical provider, a doctor or a nurse practitioner in a room with a patient, but it's about all of the services we provide, the case management, the outreach, all the different things we need to do to help low-income people get into care, stay into care, and get successfully treated.
That's wonderful. And what from the conference here do you think might help improve those numbers even further that you're hearing? Yeah,
so Dr. Dombrowski, I was just talking about her, has done some really important work to look at different ways that we can reach patients that are out of care. We, in the context of the Ryan White program, have been trying to really push out evidence-informed interventions. So what interventions appear to work? It's important, what work we have ahead of us that Julie really highlighted yesterday, is that we need to have a better sense of differentiated care. Which patient is going to need like a lot of intensive services and which patients are going to do fine with just the regular services. As I've already demonstrated, most patients in the Ryan White program do well with the services we provide, but we still have 15% that aren't virally suppressed. What more do we need to do to help reach those patients? And Dr. Dombrowski in Seattle, they have an intensive clinic where patients where they're approaching care differently. You can't take a patient who's fallen out of care because the system doesn't work for them and expect to put them back into the same system and have them be successful. We need to change the way we're delivering care to those people. And so we do have different ways of what we call providing sort of lower threshold care where they can walk in rather than needing an appointment. They don't need to be there at a specific time. Different ways of reaching them. What can you do over the phone? Do you need to see the person in person at a specific time? There are lots of good ideas that are being generated now.
Wonderful. And you have an exciting year coming up. You have a meeting on the horizon in December.
We do.
Tell us a little bit about that and how people can find out more.
Yes, so it is a fabulous meeting. The Ryan White, the National HIV Conference is our Ryan White meeting that we hold every other year. It's going to be in December in the Washington area of 2018. And it really is a time where we bring together all those people that are actually providing services in the field. So all those people that are responsible for having 85% viral suppression among really low-income patients are going to come together and learn from each other. So places that are struggling with certain things, we have other places that are excelling. So what are those places that are excelling? What are they doing differently? And they'll be able to come together and share that information.
Wonderful. Learn from each other. Well,
exactly.
Looking forward to seeing everyone there. Thank you.
Thank you.
Thank you so much for joining me, and thank you for watching at home. We'll be back with more from CROI later today. For more information, please visit hiv.gov.